There we go. Thank you, Robin. Natalia.
Hello, everybody. I'm Natalia Lashko. I work in adult and children's social care and help staff in operational services and back office services to improve and manage change. I manage project managers.
Sorry, okay, who else have we got? Yeah.
Can we just ask everybody to mute if you're not speaking, please? Thank you. Claire, there, thanks.
Done it. Okay. Sorry, where was I?
So just a Natalia. So we've got Joe, Bianca.
Bianca.
Hi everyone, I'm Bianca Sankey, Senior SEN Officer within the Preparation for Adulthood team in Oxfordshire. So our team is around the EHCPs and the applications for EHCPs and reviewing the EHC plans. So we process those reviews.
Lovely, thank you. Joe?
Hi there, I'm Jo Milsom. I am Assistant Principal for Student Engagement at Abingdon and Whitney College. So I'm overseeing all of the provision for students with special educational needs at the college, amongst other things. I'm quite new to the college. I've done similar work in Buckinghamshire for about 10 years, but I'm new to Oxfordshire, so bear with me on some of the processes. I keep needing to check what things are called because they're called different names across the border. But it's lovely to be here this afternoon.
Thank you for coming. Anyone else have we got, Cathy, that you can see on your screen?
Can I just say I'm Christine Neal, I'm a SEN officer.
Thank you.
Oh, hi, Christine.
Bianca is my Hiya, Bianca's my senior officer and I'm a SEN officer for Preparation for Adulthood for the North.
Lovely, thank you.
Hi, can I introduce myself? I'm Laurie Granville. Hi.
Thank you.
Oh, hi, Laurie.
Hiya, I've got two hats. So Mondays I work for SENS. I'm the autism coordinator at Abingdon and Whitney College. And then the other days I'm the Tier 3 lead at City of Oxford College. So working with learners with MLD and autism.
Lovely, thank you very much. Anyone else? Am I missing anyone from the professionals? No? Lovely, thank you. And thank you for all giving up your time to come here today. It's really appreciated. So I'm going to go through some ground rules. Obviously what we say to everyone right at the beginning is to be on mute, because as you know, you can hear all the background noise and it just gets really distracting. So if you want to speak or you want to ask a question, you can either raise your hand and hope one of us see you. Cathy will be checking the group chat as well. So if we've missed you, because we are looking at all of you across two screens on our computers. We need two computers, Cathy, for these. Just either raise your hand. I think there's a little button that you can, there's a reactions at the
reaction one, yeah.
If you just hover over it, there's some reactions and you can just put your thumb up or you can wave your hand and we'll see that as well. So there's a couple of ways to get our attention. We are multitasking and I have to say it's not one of my strengths, but there you go, we are trying. So we are going to be recording this. We are recording this. If anyone has a problem with that, let us know. It's mainly for us so that we can go back and check, but we are using it to share with funders who've funded us to do this work, especially during this crisis. We've been given a small pot of funding, and it's so we can show them and demonstrate that we've done what we said we were going to do. Sorry, I've got two more people to let in. Anything else? Yeah. I'm going to hand over to Cathy. Oh, actually, the one thing I'll say first is we don't want to talk about everyone's personal experience. Although you're here because of your personal experience, we think it's really important if we can keep it as generic as possible. The professionals in the room are not going to be able to go into detail answering personal questions. If there is something, I'm sure they would agree, they would all be happy for you to get it and then they can follow it up. But at this stage, it's to try and get as broad generic sort of feel for what's going on locally and what's happening, because it just all feels a bit like we're a bit lost at the moment and we don't really know what to do or where to start, and our usual ways of finding out kind of disappeared. Kathy, did you want to just say something about privacy and emails and things?
Yeah, so obviously everybody's signed up to this. What we do is we follow this up with a written question and answer session, because sometimes we don't get time to answer all those questions that everybody's sent in, and usually the professionals are very kind and actually go through them for us, so we send that out to everybody. So we obviously need to keep your email to do that. If anybody doesn't want to be on that email list, if they could let me know, obviously by emailing me first, and I will take you off. But and also, if you want to, we do try and send out information periodically. We don't like to bombard people, but with anything that we think might be relevant. So again, if you'd rather not receive anything, just let me know.
Lovely. Thank you. Okay, so we asked people to send in some questions beforehand, and we will share those with the professionals that are here that will then go away and get the answers for you from their teams. But I'm going to go through some of them. We have got rather a lot, but we may not get through all of them. Anything we don't get through, we will get back to you with the answers to those questions at the end. So one of the questions is, at what point do OCC think transition should be starting for those leaving college in order to plan for their next steps? This person has a daughter who is due to leave in 2 months' time, but nothing is in place. So who would like to take that one?
Gail, so should we try? Yeah, should we do what we did last time, which is I'll try and sort of work out who's the best person to answer. It might be a number of us.
That would be really helpful, Robin. Thank you.
Okay, I mean, if I start with that one, and then maybe Bianca, and sorry, the person's name who I can't remember is from the colleges, may want to also add. I know the discussions we've been having is that year 9 is a really good time to start think. I mean, I know for years, Gail, we've even said earlier, but at the moment, I think we're thinking year 9 is a really good time to start to think about adulthood and the future. I don't know if colleagues want to add to that. Bianca, have you got
So I think this will vary depending on the young person and their needs, and that'll be on an individual basis and should be outlined in the EHC plan.
Yummy.
And yes, I guess that parents and young people can always contact their SEN officer if they have any further questions in terms of individual circumstances.
Yes, I mean, I think what the general view is that year 9 review is a point where we start to sort of talk about it and record it.
Yeah.
So, yeah.
Would you like to say a bit about the college process with leaving and moving on to adult services?
Yes, please.
So obviously it is different for every young person, and I think you're right. Year 9 is really where those conversations should start in terms of what the long-term aspirations and hopes and sort of realistic outcomes are for people. But from a college perspective, once we know that a student is leaving, we would normally have that conversation at the annual review. So when I don't know which college this young lady is at, but I would have expected that at the annual review there would be a conversation around next steps. It's a central part of an annual review to talk about what's happening next. Certainly for us, we would invite social workers to those annual reviews if we know that it's going to be their last annual review in college, and we would start the process of that transition. I don't know what the timescales are like in Oxfordshire, but I know in Buckinghamshire it can take a long time, so we would often start that 2 years in advance, because we just to make sure that they'd got through the system and they'd had all the right assessments and everything for services. But I know I have checked with the staff in college here, and they do invite the social workers where they know that it's going to be their last year, and we can get that plan in place, and we will support them all the way through that to make sure until we're satisfied that everything is in place.
So can I just Can I just ask if that is somebody who is due to leave in 2 months' time, and there is nothing in place at this point, what should they do? Because we know what, you know, a lot of us know what the process should be, and what good practice would be around a really good transition would absolutely be starting earlier. But in the current situation, which feels like we've been stuck in for years, I don't know about anybody else, you know, if there's only 2 months to go and they still don't know, what should they do now?
I would say they need to contact their college. I will share with contact details for various colleagues with you after this, so that you can direct people to the right people within college. But I would say they should definitely be making contact with their college now, either their course leader or straight into student services if they don't know, or if they've tried the course leader and they're not getting a response. I think that needs to come straight in now, so we can pick that up and find out where in the process they are and what needs to happen.
Now, I haven't got a list of who sent their questions in for all of these questions. Is there anyone that's here that wanted to kind of add to that, or has their question been answered? Jessica?
Yeah, I just wanted to add, just to echo the same as Joe, that happens at the City of Oxford.
Yeah.
EHCP annual reviews are an excellent tool, because obviously we're always planning ahead. So it's about linking up agencies and working collaboratively with county to make sure that we're looking at everything holistically.
Lovely, thank you. Jessica, did you want to add to that?
Yes, please. My daughter is leaving in 2 months' time. This wasn't my question because the process has started for my daughter, and the process is with the social worker who's in the I keep repeating process. She's in the process of revising the needs assessment. But I would like to have a sort of view from adult social care about how long they think it will take them to agree that needs assessment, and then to agree the ideas that I've got for what I would like my daughter to do next year. Okay. And I imagine it might apply to others as well.
Yeah, no, I'm not on. Am I on mute? No. Okay, sorry, I thought I was on mute. So it's Robin. I was going to add on to the bit, so I'm glad you've asked, that they can also contact their social worker if they know and have one. So the adult social care process is changing, and we might do an update at the end if that's all right, because it would be good for Kathy to talk about the project group that's been involved in improving our moving into adulthood pathway. But currently, the process is that we would need someone, we like someone to be referred as early as possible. So if someone is already known to the SN team or children's social care, then what we ask is that people are referred into through our social and healthcare team, and we can put that detail in the questions when we reply. At about 17, so by their 17th birthday, we'd like to know about them. In advance, we should be expecting them, because we meet monthly with our children's social care and our SEN colleagues, just sort of trying to plan and know about the people that are coming through. So what we ask is that people get referred at 17, and then we try and assess by the time they're 17 and a half, so that there's a clear plan in place by the time someone turns 18. Now, that doesn't always happen, because we haven't always had the capacity to do that, so that's our aim. If someone is coming in to us after 18, so we know that people move through transitionals, move through into adulthood anytime between about 17 and 25, so they don't always want to be in contact with us at 18. So again, we would ask that people be referred in through our social and healthcare team. And at the moment, I mean, as early as possible. At the moment, we would hope to be sort of in contact within about six weeks. But that varies depending on the time of year, and of course the coronavirus has had an impact on that as well. Does that answer the question?
Yes, I think so. Thank you. If anyone else has got any other questions to add to that, otherwise I will. Lisa.
Hi there, can you hear me?
Yeah.
Hi, I did have a question around what Robin just said. I mean, my son is coming up to be 18 in August, and we did a self-referral online, but we still haven't heard anything. So obviously you're saying coming in as soon as possible. We've never had any social work involvement prior, and obviously moving into adult services, that's when we need support to be independent. So is it just a case of sitting and waiting from that self-referral?
I didn't quite catch all of that. Can I tell you what I think I heard?
Yeah, go for it.
I think, sorry?
Can you hear me?
I can. I think you said that you'd referred in August. Is that right?
No, he's due to turn 18 in August. So
right,
we're
yep.
well over 17 and a half. And we've self-referred line with the, from our SEN office.
Yeah.
But we obviously still haven't heard anything. And I was just wondering, obviously, I know with the state of things, it's just a sitting and waiting and seeing because he is due to turn 18.
Okay, so the quickest thing for me to do is to get your details at the end, and I will have a look for you and come back to you.
That would be amazing if possible. So much appreciated. Thank you.
That's fine. Gail, what's the best way to do that? Or Kathy, is that will you send me?
I'm happy for you to have my email.
Okay. I can kind of put you both in touch. So Lisa, if you just email me, I'll put you in touch with Robin.
Thank you very much. Thank you.
Okay.
So we did have an additional question to that from Helen, which is around transport. So due to start Whitney College in the autumn, when should they start inquiring about transport?
I'm not sure who's the best person. Go on.
So I was going to say they can it's Christine here. They can apply through the Oxfordshire County Council website for transport. There's an inquiry bit where they can select what they're inquiring about, and they can email the transport team directly. If they have a SEN officer, they can speak to the SEN officer who can start that. But they can do it from any point from now.
Okay.
Shall I add something to that?
Yeah.
Yeah.
It depends a bit on age as well. So if someone is up to, I think it's up to 19, that transport is available. Beyond 19, it needs an assessment. So there's a referral process exactly like the one I just described. If transport is needed to get to college, because it becomes part of an assessment after the 19th birthday.
Okay, thank you.
So what I think, it sounds like what we need to do is share the guidance on that.
I think that would be really helpful. Mel?
Yeah.
Sorry. Can you hear me okay?
Yeah.
Just a further one on the transport. So what happens if your child already has transport to college, but they want to move to a different college?
Bianca, are you able to answer that one?
If they were to move to another college, they would have to reapply for the transport. But if they'd still meet the eligibility criteria if they'd met at the previous college.
Okay, thank you.
Okay, and then we had another comment. With the new laws that have been brought in place last Friday, what's happening with regards to the timescales for education, health and care plans that are not completed yet for transitions taking place this summer? Not sure who wants to take that.
That'll be one for Bianca, I think.
Yeah, so the new guidance states that we have to use our best endeavours, which we are continuing to do. In terms of the preparation for adulthood team, we are kind of keeping up to date with the timescales as much as we can, and it's business as usual for us in terms of that and the deadlines.
Okay, thank you. I'm just looking to see if there's any responses to that before I move on. Okay, happy for me to move on.
I'm not sure if Christine wants to add anything to that one.
Sorry, what's that?
So with the new guidance that came out, the relaxation is only on until the 31st of May for the new assessment. So it's a roughly a 4-week extension, but we are still working, using our best endeavours to keep to the deadlines that we have. But it's only a temporary relaxation of the legislation that they've put in place.
Okay. Thank you. Anjali, you need to unmute. I'll unmute you. I've unmuted you, it's fine.
Thank you. Where can I find the eligibility criteria for transport?
Bianca, are you, can you answer that one?
I can share the link at the end if you want. It can go out with the email maybe that Gail's writing up, but it's through the Oxfordshire County Council website. If you put in the search bar school transport, it will take you to it.
Yeah, and the local offer will have more information there.
Thank you. And must it go in the EHCP plan?
Andy, I didn't quite catch that question.
Is it in order to have transport, must it be in the EHCP plan?
No,
as
so
a need.
that's
okay.
Oh, sorry.
No, go.
No, so it doesn't need to be in the EHC plan for transport to be delivered. It's a separate process.
Thank you.
Just to add to that, I mean, that process should be on our local offer on the website. So if it isn't, we can follow that up as well.
Lovely, thank you. Okay, so one of the other questions that we had was if college doesn't reopen before the summer holidays begin, what support will college be able to offer my young person with help to help with the transition to their future programmes of activities?
So yes, one of our first thoughts when all of this happened, to be honest, was how on earth are we going to manage to get all these things done that we would normally do in the summer term? It's developing at the moment in terms of what we're going to do. It's very much at the forefront of our mind. We have a range of things planned. What we are doing at the moment for students who are coming into some parts of college at Abingdon and Whitney, we will be having virtual transition sessions with Carly, who's our transition worker and the course leader, and other students within that are also coming into those groups. Depending on how successful they are, we could potentially make those more regular as we go through the summer. So that's very much something that we'll be keeping an eye on and developing. We are also looking at what else we can do that is online. So the college as a whole is considering this. Lots of colleges have had open days recently, which they've had to move online. Our next scheduled open days are not until June, but they will now be online open days as well. We also have our faculty staff across all areas looking at what materials they can put together that we can make available online, that will include things like videos of staff introducing themselves and talking about their areas. We're sort of getting together all of the videos and the photographs we might have of the campuses. Hindsight's a wonderful thing. If we'd known about this beforehand, we would have walked around and quickly filmed everywhere, but of course we didn't have that opportunity. So we're doing as much as we can to get together the resources we've got, and we will be looking at how we can use Teams and Zoom to do some online stuff with prospective students. But we're also open to suggestions as well. So if as a group, and this is perhaps a question for Gail and Kathy to put out more widely to your network, if there are suggestions from parents of things that they think would be really useful, please do come back to me and let me know, because this is new territory for all of us, and we're totally up for ideas. I'm very happy to come on to meetings like this and answer individual questions again. Really genuinely looking at what more we can do and how we can develop things. But certainly if you have a young person who is coming into one of our courses within our pathways provision at Abingdon and Whitney, you should over the next few weeks receive a contact from Carly with an invite to an online transition.
Okay, thank you. And we'll certainly be happy to do that, Jo. We also manage the Parent Carer Forum now, so and have done for the last sort of year and a half. So we can share that more widely through their networks as well.
In Oxford, sorry to interrupt you.
So, sorry, who was that? Jessica.
Sorry, in Oxford, just to let you know, yeah, obviously in preparation for this meeting today, I spoke to some of the directors and just say they're looking at differing strands, calls, transition online. It's obviously taking time, all new to everybody, but obviously want to get it right. So in terms of consultation, they're being responded to, and soon, especially within life skills, tier leads will be sending out letters to prospective parents. So we're slowly but surely trying to put a package together.
Lovely, thank you. Jessica, did you want to? I've unmuted you. Oh. Can't hear you.
I wondered if you could say a bit, Jo, about students who are already at college, who are moving on to daytime activities, particularly perhaps students in pathway 1 and 2.
Yes, of course. Obviously, that is also a major concern. We are, if you're a parent of us currently, I don't know if you are or not. I'm sure you've had quite a bit of contact. I know our course tutors have been working really hard to stay in contact with people. It's going to be a challenge for us as to how we can best support those students. And at the moment, I don't have anything definite that I can say to you we're doing. But what I can assure you is that we won't forget about them. We will do everything we can to support them, and if that means that we need to rethink what September might look like, then that is what we will do if we need to. I think at the moment across the country as a whole, really, we're all hanging on the words of the politicians and waiting to see what the next move is going to be, and that's very much going to help us plan what we do moving forward. As a senior management team at the college, we are starting to have those conversations now about potential different scenarios come September. We're working very closely. We're very lucky the Association of Colleges is supporting us very well and campaigning for us with the government and with the Department for Education in terms of helping us think about what we will be able to do in September and what flexibility we might need in terms of funding and guidance and things like that, so that we can make sure nobody's disadvantaged, or at least minimise the disadvantage. So I think that's one that we do need to think about. Again, I'm open to ideas and suggestions for how we can best go about that. But we won't forget you, and we won't leave you high and dry. That much I can promise you.
Just very quickly, thank you, Jo. That's really reassuring. Thank you very much.
Good.
Elaine North has just joined us. Elaine, do you want to introduce yourself?
Yes, hello. I'm really sorry about my delay getting in. Lots of security issues getting through our firewall on OCC. So I'm the Education, Employment and Training Casework Manager for Oxfordshire, and our remit is really for young people post-statutory education age. So the year 11s that are leaving this year, we will be picking them up if they're at risk of NEET for September. And our support goes on until September after their 18th birthday, and if someone has an EHCP or is part of the leaving care system, then our support carries on until they're 25.
Lovely, thank you. And I'm sorry, I hope your delay wasn't me not letting you in the meeting room, because I
No, it wasn't at all. It was purely the ICT firewall, I think, asking me all sorts of questions to get through.
Okay, well, thank you and welcome. Okay, I'm just going to move on unless anyone wants to add anything to what they've heard. Scrolling the screens. No? Okay. So, and actually it kind of follows on from that, because one, we did have an email from a parent who's really worried about her son. He has an education, health and care plan. He's currently got no plan for his future. He's 16. He's in year 11 at the moment. Hasn't applied for any post-16 education, and he's refusing to engage in any conversations. She feels that if he'd been at school, there would have been that peer support, and that sort of peer pressure would have helped a little bit. She's spoken to the SEN officer and emailed the base, but is no further forward and is feeling increasingly worried. I think she's worried that he's going to end up NEET, so not in education, employment or training. He won't engage in online learning either, and she's just yeah, she wanted to get that question out because she thinks there might be other people in the same situation or a similar situation. So I'm not sure who wants to take that.
I can give some guidance, some signpost in there. So currently, as he is year 11, obviously he's still on school roll, but with that in mind, if I knew where the school was, we could make contact with them and just sort of get a bit of background. And if he was, or him or mum were open to referral into us, we would happily offer some signposting around September for what happens in September. But not only that, we could pick up casework referral at the end of June, and that means we could work intensively with him, looking at his options for September. We also offer web chat via our website, which is, do you want me to tell you that, or do you want me to email it through to everyone?
I think what might be a really good idea is if we can have if you're happy to share your contact details.
Yeah, absolutely.
So that I think a part of the frustration for families is just not knowing where to go with all of this. And I think particularly in the current situation where everything feels all up in the air, then I think families need that kind of reassurance that you are still there, you are still doing all these things. It is business as usual. It's kind of why we want to do this event today as well, so families could see that. So if you're happy to share your details, Kathy can share them with the families that have got in touch with us.
Absolutely.
Okay.
And I think the website that we have is really useful for you can web chat with someone, it gives you lots of information, and then also it gives you those signposts to who actually can support after school leaving age.
I think that'd be really helpful. I mean, the more we do this, Kathy, I'm thinking, and Anjali, I'm looking at you, the more I think our moving into adulthood guide that we shall hear whether we've got funding for tomorrow to update our moving into adulthood guide. We did a transition matters guide about 11 years ago, which was a handbook for parents going through transition. It had all that information in. Of course, that's out of date. We're trying to get some funding to put one together, so it'd be really useful to kind of work with all of you people here and others to pull that together in a really co-produced way. So we'll keep you posted, fingers crossed for us. Okay, I'm just looking to see if there's any other comments before I move on. Okay, so I've got this one from a parent who says her daughter has a place at Henley College to start in September. It was confirmed by education, but they've said adult social care. Again, it's a transport one, should fund transport. So would that be you, Robin? Since lockdown has happened, she's heard nothing further and wondered what the process is for decisions by social care in relation to transport, and whether she needed to do anything else, and when she might hear about a future decision.
Okay, so I think that refers to the point we made earlier. So I'm assuming that the young person is probably 19 or above. So they just need to refer. They can do an online referral, or they can phone up the social and healthcare team, and we will put the details in the question and answers. But if they can't wait, if you go onto our public website, and on the very front page, it takes you into the adult social care contact details.
Okay, I guess there's also a general one here about transport, and I guess that kind of shows that the lack of sort of information that families see. I mean, we know it's out there, but is it out there in an easy, accessible way for people? Do they know where to find it? So one of the questions was around post-16 education. Do they automatically get transport because they're hearing so many mixed messages from other people?
Bianca, do you want to start with that, and then I can finish?
I guess the lack of clarity is certainly something that we can take back and look at. If they are moving settings, then yes, they would need to apply again. If they were already receiving that transport, though, like I said before, they would meet the eligibility criteria. That wouldn't change. And if they were staying at the same setting, then they wouldn't need to reapply. It would just continue.
it's probably worth adding that that statutory offer stops at 19, and that's where people have to be eligible under the Care Act. So the Care Act, which is the legislation that starts at 18, and that's why at 19 that referral is needed into through our social and healthcare team, so we can do that assessment and hopefully support that need to get to college.
Yeah.
Okay. Any questions, Anjali? I've unmuted you. Can't hear you.
So can I just clarify then, up to 18 for transport, it doesn't need to be on an EHCP plan. There's a process separately that you can follow through the County Council website. But after 18, so on the 19th birthday and beyond, there would need to be a full care assessment of that person, which would need to then include transport needs being assessed and then funded by social care. Is that correct? Because if that is, then I think very, very few families have understood that. And I also think that there's a real confusion around travel training and how that's accessed and provided, with people being very unclear who funds that and how they get to have that. I think there's probably quite a lot of misinformation as well, from parent to parent rather than professionals to parents. I think possibly parents who've been refused, not understanding fully the process, or they've not heard, and then perhaps not being very, well, certainly not being very positive, and therefore, you know, maybe frightening as well. So the sooner we all get the correct messages out, the better for everyone, really.
So I think it's quite an important point, and I think that we're probably dependent on the colleges and OxFSN, and because we don't know people until we know them, really. So I guess it's making sure that OxFSN and the colleges are clear about that. There is a process, so we just need to make sure that people have got it. And then I guess we're dependent on colleges ideally sharing that with families, and I don't know how easy that is. But yes, that information, and also it should be on our local offer, so we will make sure that it's on there as well.
Cassie.
Can I just come in on that? So I've been working with through co-production on transport, and one of the issues that they find is that often families are being told that they're eligible for transport, and then they find out they're actually not. And that's what the issue is a lot of the times, why families then are not finding out until maybe a few days prior to term starting what the situation is. So is there anything that could be done about trying to make sure that the people who are giving the information are clear also on who is eligible and who isn't?
Yes, I can't answer that because it's not something I have oversight of. I don't know if you can offer any advice on that, Bianca, or maybe we need a separate one of these on transport. But it sounds like we need to get some clarity and come back to you.
Yeah, and I'm the same. It's not, you know, it's a separate process. I don't think there's anything I can add to that, unfortunately. But we can certainly go back and seek further clarity, and perhaps a further session around transport would be beneficial.
Yeah. Okay, I'm sure we can arrange that. Can't you, Cassie? Okay. So Karen, I'm sorry, I missed your question earlier. So Karen England, do you want to ask it again? It was around...
It was just about accessing adult services. If that happens any time between 17 and 25, why is it 17 for some and 25 for somebody else? What's the criteria?
It's based on need, really. So it's really about personal choice. So some people are living at home and they don't want or need support from adult social care. Others will need it right from the beginning. I think it depends on individual need, basically. So I think, so if we've got someone who's maybe a looked after child, so a child who's been looked after as a child, then obviously they will need immediate support. If someone's living at home and they're going to college, and they don't particularly need anything from adult social care, then most people would say that they wouldn't want an assessment at that point. Does that help?
Okay.
And I think it's important to remember that even if you haven't had any support through children's social care services, it doesn't mean to say you might not be eligible for adults, because things change, circumstances change, and you can enter that either system at any point, actually, because it depends on the needs of the person, as Robin has said. So, okay, so we did have a question around supported living. So what advice do OCC have for families currently looking for supported living for their family member who's either ready to move out of the family home or is currently out of county and about to leave a residential college?
Okay, so I'll cover this one. So this can be quite a difficult area, and I will explain why. So what happens is linked to the last question, actually. I mean, if some people are quite happy at home and want to stay there till 25, 30 or 35, other people, for various reasons, may want to move out of the family home at 18. At 18, in our view, it's quite a difficult time to be considering supported living, for various reasons. One of them is if you've never lived away from, and I'm probably telling you things you already know, and I apologise for that, but if you've never lived away from home before, supported living can be quite a new and quite different environment. Also, if you're used to living in a family or around people of your own age, the way supporting living works is we have about 700 places, I guess, for supported living in Oxfordshire. So Oxfordshire is quite good at developing supported living and making it a local offer. But it does mean that sometimes the perfect option isn't available when someone wants it. So often young people want to live with other young people. That can't always be guaranteed. Just it depends on where the vacancies are, basically. So what we tend to do is we tend to sort of offer as much support at home as we possibly can. And I think sometimes there may be misunderstandings about that, about it being a funding issue. And I mean, obviously we have to manage the money, but often it's to do with wanting to do that move away from home very slowly, because we want it to work and we want it to be successful. So what we will try and do is maybe look at some overnight stays, look at time, maybe some weekend stays away. We also look at shared lives. So sometimes if you've lived in a family, and I know some families really don't like the idea of shared lives, but sometimes if you've lived in a family, living within another family is quite a good stepping stone to moving away from the family home. So there's not an easy answer to supported living, apart from, again, we want to try and meet the person's individual needs. It might be about where they're working, or where they're in education, or where their family lives. Some families move away, so we then look at maybe supported living outside of Oxfordshire, but obviously we want to keep people as close to their local networks and their local communities as we can. So that's our approach. I don't know if that helps, but I'm happy to answer any other questions around that.
Anyone want to ask anything following on from that? Yes, and I can't see your name because it just says iPhone. I'll unmute you. There you go. Hello.
Thank you. Hello, I'm Davina. Hello, I have a child who's in year 9, but very related to what you've just said. My child goes to an Oxfordshire school, but I live in Berkshire. Would Oxfordshire consider doing exactly what you've just been talking about with moving out of the home but living in Oxfordshire, and because I'm on the border, or would it be something that has to be within Berkshire?
Oh, that's a difficult one. I mean, my instinct is to say we want to actually meet the person's needs and their family needs. Ordinary residence comes into that as well. So the local authority that is responsible is the one where that young person is ordinary resident.
Yep.
It's as a child, well, there's some complicated case law around this, so it might be a separate conversation, but as a child, normally that's where the family home is.
Yeah.
But it's also, if you're on the border, that might be sort of slightly flexible, so it might be a separate conversation, I think.
Okay, thank you.
Because your health need, because just to tell you that the ordinary residence is based on where you live, but often health needs are about where you're registered with the GP. So sometimes it gets a little bit confusing around the borders.
Yeah, okay, because the school is in Oxfordshire, but home is Berkshire, so that's why I'm on this.
Yeah, I'm happy to have a look at that if that would help, because it is quite confusing.
Yeah, it's something that I'm very keen on because of the complex needs my child has. I know you don't want to get into individual cases, but
okay,
that was just an interest of mine.
Okay.
Okay, no, happy to have a separate conversation.
Thank you.
Great, thanks. Okay, so we've got a couple coming through, but I am really conscious of time. So I think somebody asked me something about clarification around travel training. Who was that? Helen, I think. We can send you information about that if it helps, Helen. She's still there.
That would be very helpful to have some information about travel training, because I didn't really understand. I mean, obviously at the moment 2 buses is not a viable option for my son, but I don't exactly know what travel training would be and who would provide it and how it would be funded, because I work full-time as a nurse in the NHS. I can't take him to college every day. It's just not viable. And I couldn't do travel training every day, which is what he would need for weeks and weeks and weeks. He gets stuff really well if he can do it for weeks, but it would be a long process.
Okay.
My Life, My Choice used to do, and I would be wrong to say that I know it's completely still going, a mentoring travel training where they partnered up learners with suitable people who've been obviously safeguarded checked, and they did differing routes on public transport. That might be something worth exploring.
Well,
they,
just Google it.
They're called My Life, My Choice. They have a travel buddy scheme that they've been running for some time. So the information will be on their website, Helen.
Thank you.
Can I just add as well, this is something that the transport department are looking into, but of course everything's kind of got a little bit on hold because of the coronavirus, but this is one of their things that they would like to try and expand as well. So there may be other options moving forward other than just My Life, My Choice. It depends on whether they've got capacity to be able to, if they've got enough people that can actually do that.
And it's not.
Can I add something to that?
Alternative. Yes, Robin, sorry.
So I think it also depends on the age of the person. So I know the colleges also do, is my understanding, the colleges also are trying to enable those skills and independence and things like that as well. But I think the important thing is it's a statutory right to get to college. So whatever happens, it needs to happen, certainly from 18 anyway. So our approach would be that obviously people get a lot of pleasure about being independent, being able to do it themselves. So if it's at all possible, and if My Life, My Choice can do it, if not, we would arrange support PAs to do that travel training as well. If My Life, My Choice didn't have the capacity or whatever, we also would want. I mean, taxis always feel like they're a last resort, really. So the other option is whether a relationship, whether there are family members or whatever that might want to be paid to do it, or PAs to do it. It's sort of just trying to work out what's the best thing that's going to work for the young person and the family arrangements, because clearly you need to be able to go to work.
And it's something that could be in their education, health and care plan, shouldn't it? If this is something that they will need in the future.
Well, particularly if they can learn to do it for themselves, yes. And it doesn't really matter how long it takes.
No.
We brought it up in the last EHCP meeting, but this is specific, so I should talk to somebody more generic, out of this meeting. That's not fair on other people, really. But it was just finding out what the options are, because we have been told probably we're not eligible for transport and we can't do it either. So it's just knowing what other options are available. The college already said they couldn't meet him from a bus stop either.
And if you want to get in touch, if any of you have any of those questions that if we don't already know the answer to it, we have the links and the networks to be able to find those questions out from. So please use us as a conduit to that, because that's what we exist for, really. So do make the most of contacting us directly, Helen.
Thank you.
Okay.
The bit I just should add to that, because I don't want to set up expectations, is adult social care unfortunately does have to charge. So there's a charging policy. So as soon as you become an adult, nationally, the expectation is that you have to charge people. It might be a nil charge, but I just need to make sure you're aware that there is a financial charge. I think most people probably come out pretty much nil or at this level. But yeah, I just thought it'd be wrong of me not to mention it.
Yeah. And I guess there's so much, isn't there? I mean, we've tried to cover quite a lot in such a short time. We used to do workshops on transitions, and it was never long enough, even the 3 or 4 hours to do to cover everything. So we've tried today to cover a few points. We haven't. If anyone's got any last questions or last burning issues before we start to sort of close, just wave at me madly or shout.
Only that we did really want to share what the new model might look like.
That's kind of what I was coming to now. That's why I was.
Oh, good.
I haven't forgotten you. So yes,
good.
You want to talk through that then? You all. Yeah.
I was going to bring Natalia in for that.
Okay.
She's still there?
Yes, I am. Yeah, I just unmuted myself. I think, as Robin mentioned at the beginning, it's a fantastic opportunity to share with you our plans for next steps for bringing how we support young people we've just been talking about and their families to prepare for independence and adulthood. And I think about 2 years ago, Kathy and some other people on the call and other have done fantastic piece of work at looking nationally what good might look like and really challenging all of us on Oxfordshire experiences and saying we absolutely want and can do better. And that has been welcomed and received. And I think what we did last year actually looked at how we run our business across children's social care teams and adult social care teams, and what would a different model look like for people and families from 15 to 25. And the council has agreed what that new model would look like in February, and actually allocated a little bit, but still welcome additional resource for us to make sure that we have the right staff and the right skills to do that. And what we are now able to do, bearing in mind the national emergency we're living through, is to start implementing this. And the timeline we're working towards is to have the first phase of that new model up and running in October. So we actually know who's on the new team, and they get inducted together and they start working together and do a public launch in the new year, because that's the time it will take us to consult with staff, because some of those roles will be new and that's a requirement. So a lot of work is already happening, and more will be happening over summer and in the autumn. But the good news is it hasn't been forgotten. It's absolutely rooted in that initial piece of work which has been done 2 years ago, and we're going to just get on with it, and absolutely going to update yourselves and some communications to people who've already expressed interest in that area will be coming out next week.
So if I just add to that, just quickly, the model is based on work with young people and with families, and the principles were set by that group, and then the model has been developed from there. So the idea, what will be different is that we will have a single team. This is for social care initially, working across from the age of 15 right through to the age of 25. So what we're trying to do is change that cliff edge that people refer to at 18. So it means that you'll be, hopefully, have a named worker, that's what we're aiming for, to help people through and navigate through that sort of 15 to 25 year period. So that's, I think the request was for what we call a single age pathway. So there'll be a 0 to 15 path and then a 15 to 25 path. And the idea is that we'll have a better focus on what young people need, planning for the future, and some of these issues that we're talking about housing, about accommodation, about transport, and all those sorts of things. So we tried to whiz through that. I hope that's helpful.
Angeli. Unmute.
Sorry. So my son is going to be allocated a transition social worker. Very, very exciting. And in the next couple of months, so I'm thrilled. Does that mean she will stay with him until he's 25 under this new model then?
Yes, basically. Under the new model, yes. We'll have a transition into the transition, as you can imagine, but that's the principle, yes.
Cool, brilliant, thank you.
And can we request that we sort of are involved with any sort of planning, or because we've been doing this stuff around moving into adulthood for so long. I feel like I've lived and breathed it since my son was 12, but it's just so, I mean, I know Kathy's on the co-production board, so she will hopefully be involved as well, but it would be good.
So there'll be a project board, and the intention is to include people from the original project group and from OxFSN.
Brilliant, thank you very much, appreciate that. Okay, unless there's anything else, that's over the hour now, but I guess it's an hour since we really started, but unless anyone else has got any burning issues. I did see somebody with their hand up, but they seem to have disappeared. Oh, Joe Barnicoat waving madly at me. Unmute yourself. Unmute.
It's just clarification for everybody that, going back to the post before, that charging for adult social care, it's not the family, it's the young person income that it comes out of. Going back to what Robin was saying, that the charge for the transport.
Okay.
So the family, don't worry, it's coming out of all your income. It's for the young person to pay for their benefits.
Oh yes, that's very true.
If after this session there is anything, I mean, it's so honestly trying to see whether people want to speak and look at the questions. It is. I'm sorry if we've missed anyone. We haven't got the questions answered, but do email us and we will add them to the list of questions that we're sending out. I hope you've found it helpful, but if it seems to me such a large range of issues at the moment to do with just this stage in life, as always. If you would like us to do a more sort of targeted on one specific issue, definitely look at transport if that is a burning issue for people. Just get in touch and let us know. So I think, unless anyone's waving at me.
Hello, Gail.
Who's that?
It's Joy.
Hello.
Hello. I wanted to ask if it was possible to add housing into the HCP plan, the EHCP plan. If it was an issue, you know, because I've been having this issue for the past 10 years and it's still not sorted out. And JJ will be moving into college soon and he's not safe at home. So what do I do?
I guess it would be dependent on the individual issue, and perhaps a conversation outside of this forum would probably be the best.
It's because we've done everything we have, but I have a meeting next week with everybody, but I needed to make sure where is our right about a young person moving into adulthood.
I think Joy, sorry, I think that will something that needs to be kind of asked outside of this thing today, because we're trying to keep it, as I say, as generic as possible. But we can put you in touch with the people that you need to speak to.
That would be great. Thank you.
Sorry.
And if you have. Sorry, and if you do have a meeting scheduled for next week, you said, then I'd raise it at that meeting and see if the professionals that are within that meeting can support you further.
All right, then. Thank you. Cheers.
Okay, so just about to close. Thank you very much, everyone. I hope you found today useful. Thank you to all the professionals that came on and gave us their time. And stay well, stay safe, and be in touch. We'll be coordinating questions. They will be put on our website and via, sorry, the questions and answers, not just the question. That will be on our website as soon as we have them. Anything else, Kathy? Am I missing anything?
No, I don't think so. We try, if there's no objections, we try and put these onto our YouTube little channel just for people to be able to refer back to if they forgot something. But You know, that's obviously if people don't want that, that's fine. We're quite okay with that. We know that not everybody likes to stick themselves. But no, just great. Thanks for everybody coming on. And again, as Gail said, if you've got any other further questions, just contact us, because we can then direct them at least to the right people if you find that you're not getting the answers you need.
Okay, lovely. Thank you, everyone. Bye.
Thank you. Thanks. Bye-bye.
Thank you very much. Bye-bye. Oh, okay. I love it. What? Right. I just goes now. Before my one starts.